Hi, I'm Sam and this is my trach care video. So first thing, I would come into the patient's room, do hand hygiene, close the curtain for privacy, identify the patient. Hi, Miss Jones. Double check that it's her. Going to assess the need for trach care. And Miss Jones, you do need trach care today. Your dressing's a little soiled, so we're going to get that changed for you. If at any time during the procedure you feel like you're having some respiratory distress, we'll stop the procedure. I gave Miss Jones pain medication about half an hour ago, and she said she's not experiencing any pain now. So since the patient is conscious, I'm going to raise her into the semi-Fowler's position. If she was not conscious, she would be in the lateral position. I'm also going to raise the bed at a good working height for myself. I'm going to bring my supplies over. Place my trash within reach. Put an absorbent pad on Miss Jones' chest. Keep her dry from any secretions. And I'm going to come over and open my sterile field. Grab the saline, check that it is saline and it's not expired. Open it and place the cap facing up. Bring it over here, not touching the field while I'm pouring it or reaching over. Put the cap back on. I would then put on my mask and put on clean gloves. I'm going to remove Miss Jones' oxygen, set it aside, hold the faceplate with my left hand and unlock the inner cannula. Pull it out gently and discard of it. And I'm also going to take the soiled dressing off. I'm going to throw that away. Take these gloves off. Throw those away. And I'm going to come over here, set this aside because we're not going to use that. Then I'm going to put on my sterile gloves. Picking up the first one, touching only the inside and removing it from my field. Put that on. Bring my other glove over. Put that one on as well. Then I'm going to ask for some help from Lisa to come over and open my inner cannula. I'm going to reach inside and pull it out with my sterile dominant hand. Being careful not to contaminate it. Thank you, Lisa. I'm going to bring it over here and with my left hand hold down the faceplate and with my right hand insert the new cannula. Lock it into place. And I'm going to come back over to my sterile field and with my dominant hand grab a Q-tip, dip it into the saline and come over here and clean the top of the faceplate. I'm going to use the Q-tip and roll from the stoma outward, using it only one time. I would throw it away, grab a new Q-tip, dip it in the saline, come over and roll stoma outward once again. I do that as many times as necessary to clean the top of the faceplate. I would discard of the last one, pick up a new Q-tip, put it in saline, come over, lift the faceplate and clean the skin, rolling from the stoma outward. Each time throwing it away, grabbing a clean Q-tip, dipping it in saline, and repeating it as many times as necessary for the skin to be clean. I'd throw that away, grab a new one, dip it in saline, and then also clean the underneath of the faceplate, rolling from the stoma outward as many times as necessary as well. So then I would discard of that once everything was clean, and grab a gauze, hold the faceplate and pat it dry, the top and underneath the faceplate and the skin. If that got too wet, I'd throw it away and grab a new one as well. Then I'm going to come over to my field and grab a new dressing and a clean Q-tip and slide this under Miss Jones' faceplate using the non-pokey side to help me push it up so we don't irritate her. Trying to be very gentle and also hold the plate in place without moving it. You can pull that up. We want to make sure it is not too tight, but that it covers all the skin where the faceplate is so no irritation occurs. I'm going to throw this away. Next, I'm going to change Miss Jones' collar, and to do that, I'm going to ask for some assistance from Lisa. Ask her to put on gloves and hold the faceplate while I slide this in. I would grab a clean Q-tip, not one out of the garbage. And once Lisa's holding that steady, I'm going to wrap this here, slide it through, I pull that through and tie it once into a knot and then again into a knot. And I'm going to slide it around the back and have Lisa assist me on pulling it through. I'm then going to hold the faceplate while Lisa threads this side through. Thank you, Lisa. And then she's going to tie it into 2 knots again. And then when she's done with that, we're going to pull the excess over here, cut it, tie it into a bow along the neck as for easy removal if necessary. And then we're going to check the fit of the collar, placing 1 finger under each side and making sure that it fits with the 1 finger underneath and is not too tight or too loose. So next we are going to remove the old collar, and I'll have Lisa once again hold the plate in place. I'm going to slide that around and have Lisa pull it through the other side, and I will hold the plate while Lisa removes that side. Thank you, Lisa. Then we are going to replace her oxygen, making sure that it would not be tangled. Remove the absorbent pad, dispose of. remove our sterile gloves. Throw those away and remove our shield. Then I'm going to lower Miss Jones back into a comfortable position. And I'm also going to reassess her for respiratory rate, effort, pulse ox, and general lung sounds. And that's it.